Hello, everyone. I'm Dr. Naomi Chapelton, and if you are over the age of 60, or if you love someone who is, I need you to stop what you're doing right now and watch this video from beginning to end. Because today I'm going to talk about something that keeps me up at night as a physician, something I witness in my clinic far too often. Patients, smart, vibrant, sharp people, coming back to me confused, forgetful, and frightened. And in many of those cases, we eventually trace the problem back to a medication, a pill they had been taking for years, a drug they trusted completely. I want to be absolutely clear from the start. I am not here to tell you to stop taking your medications. Never stop a prescribed medication without consulting your doctor. What I am here to do is make sure you are informed, because your doctor may not have told you about these risks, not because they don't care, but because medicine is complex and appointments are short. So let's talk about the 9 popular medications that research has linked to cognitive decline, memory loss, and in some cases, rapid dementia-like symptoms in older adults. Take notes. Share this with your family. This information could genuinely change or save someone's life. The first category I want to talk about is one of the most dangerous and least discussed: anticholinergic medications. These are drugs that block a neurotransmitter in your brain called acetylcholine. Now, acetylcholine is absolutely critical for memory and learning. When you block it, even temporarily, you can experience confusion, memory gaps, and brain fog. But here's the terrifying part. Many seniors are taking multiple anticholinergic drugs at the same time without even knowing it. These include some common bladder medications like oxybutynin, which is prescribed for overactive bladder. They include certain antihistamines, yes, like the ones in your allergy pills, some antidepressants, some sleep aids. A major study published in JAMA Internal Medicine found that people who took strong anticholinergic drugs for 3 or more years had a significantly increased risk of developing dementia. And the scarier finding? Even after stopping the medication, some of that risk remained. If you are on any bladder, allergy, or sleep medication, please ask your pharmacist to review your full medication list for anticholinergic burden. That's a term worth knowing. Next, we need to talk about benzodiazepines. You may know these by names like Xanax, Valium, Ativan, or Klonopin. These are commonly prescribed for anxiety and sleep disorders, and I understand why. Anxiety and insomnia are real, debilitating conditions. But in older adults, benzodiazepines are deeply problematic. The brain of a 70-year-old processes and eliminates drugs very differently than a 30-year-old brain. The drug stays in the system longer, it accumulates, and over time, it can mimic the early stages of dementia: memory loss, disorientation, difficulty finding words. A landmark French study followed over 1,000 seniors and found that those who had taken benzodiazepines were about 51% more likely to develop Alzheimer's disease. That number stunned the medical community. Now, I want to be compassionate here. If you've been on a benzo for years, do not stop suddenly. That can be dangerous. But please have an honest conversation with your doctor about tapering off safely, and explore alternatives like cognitive behavioral therapy for insomnia or non-addictive anxiety management strategies. Now, this one surprises a lot of people. Proton pump inhibitors, drugs like omeprazole, pantoprazole, and esomeprazole, are among the most commonly prescribed medications in the world. Millions of people take them every single day for acid reflux and heartburn. But emerging research is raising serious red flags about their long-term use in seniors. PPIs reduce the absorption of important nutrients, particularly vitamin B12 and magnesium, both of which are critical for brain health. Low B12 is already a well-known cause of cognitive problems in older adults. It can cause memory loss, confusion, and in severe cases, mimic dementia. A large study published in JAMA Neurology found a significant association between long-term PPI use and an increased risk of dementia. If you're taking a PPI, ask your doctor, "Do I still need this?" Many people who were started on these drugs years ago are still taking them out of habit rather than medical necessity. If you do need them, ensure you're monitoring your B12 levels and supplementing where needed. Closely related to benzodiazepines are the so-called Z drugs, zolpidem, Ambien, Zaloplan, and azopiclone. These are sedative medications specifically designed for sleep. I understand how desperate seniors can feel when they can't sleep. Sleep deprivation is its own health crisis. But these medications carry significant cognitive risks, particularly for people over 65. The American Geriatric Society's Beers criteria, which is a guide for prescribing in older adults, specifically lists these medications as drugs to avoid in seniors because of the risks of cognitive impairment, falls, and yes, dementia-like symptoms. Studies show that long-term use of sleep aids alters brain chemistry in ways that may accelerate cognitive decline. Some patients who come to me with dementia symptoms show dramatic improvement simply after carefully tapering off their sleep medication. If you're using a sleep aid every night, please discuss this with your doctor. There are safer alternatives. Now, I know this one is controversial, so let me be careful here. Statins, drugs like atorvastatin, simvastatin, and rosuvastatin, are prescribed to lower cholesterol and reduce heart disease risk. They have saved countless lives, and for many people, the benefits clearly outweigh the risks. However, there is a subset of patients, and research suggests it may be more common than previously thought, who experience what's called statin-associated cognitive impairment. Memory problems, mental fogginess, and confusion that begin or worsen after starting a statin. The FDA actually added a label warning about this back in 2012. Interestingly, fat-soluble statins like simvastatin and atorvastatin seem to cross the blood-brain barrier more easily and may be more associated with cognitive side effects than water-soluble statins like rosuvastatin. I am not saying statins are bad. For many seniors, they are essential. But if you started a statin and noticed a change in your memory or mental sharpness, please tell your doctor. This is a known, documented side effect, and your doctor should take it seriously. We touched on this briefly under anticholinergics, but it deserves its own spotlight. First-generation antihistamines, drugs like diphenhydramine, which you'll find in Benadryl and many over-the-counter sleep aids, are one of the most commonly misused medications in the senior population. People pick them up at the drugstore. They think, it's over the counter, it must be safe. But diphenhydramine is a powerful anticholinergic. In older adults, even a single dose can cause acute confusion. Regular use has been strongly linked to long-term cognitive decline. I want to specifically address something. Many OTC sleep products, things like ZQuil, Unisom, Tylenol PM, contain diphenhydramine. Seniors take these thinking they're harmless. They are not harmless for an aging brain. Please check the active ingredient in any over-the-counter medication you take for sleep or allergies. If it says diphenhydramine, have a conversation with your doctor or pharmacist about alternatives. Most blood pressure medications are safe and incredibly important. Uncontrolled high blood pressure is itself a major risk factor for dementia. But there is a class of blood pressure drug I want to flag. Centrally acting alpha-2 agonists, such as clonidine and methyl-dopa. These drugs work partly in the brain, and they can cause cognitive dulling, sedation, confusion, and memory impairment, especially in older adults. They are generally considered less preferred options for seniors for exactly this reason. If you are taking clonidine for blood pressure, ask your doctor whether there is a more brain-friendly alternative. ACE inhibitors, ARBs, and calcium channel blockers are generally better tolerated in terms of cognitive effects. Additionally, there is research suggesting that very aggressive blood pressure lowering in elderly patients, particularly those who are frail, can actually reduce blood flow to the brain and worsen cognitive function. Blood pressure management in seniors needs to be individualized. What works for a 50-year-old may not be appropriate for an 80-year-old. Depression in seniors is tragically underdiagnosed and undertreated, and antidepressants can be genuinely life-saving. But the older class of antidepressants, tricyclics like amitriptyline, nortriptyline, and imipramine, carry significant cognitive risks due to their strong anticholinergic properties. Amitriptyline in particular is one of the most commonly prescribed drugs in this class, often used not just for depression, but for nerve pain, migraines, and sleep. And it's one of the worst offenders for anticholinergic brain burden. Newer classes of antidepressants, SSRIs and SNRIs, are generally much safer for the aging brain. If you or a loved one is taking a tricyclic antidepressant, please discuss with your doctor whether switching to a safer alternative makes sense. I say this as someone who deeply respects the importance of treating depression. Untreated depression also damages the brain. It's about finding the safest, most effective option for you. The final medication category I want to address is opioids. Drugs like oxycodone, hydrocodone, morphine, and fentanyl patches. These are sometimes necessary for managing severe chronic pain, and I never want a senior to suffer needlessly. But chronic opioid use in older adults is strongly associated with cognitive impairment. Opioids affect multiple systems in the brain. They can cause sedation, confusion, and delirium. And when combined with other sedating medications, which many seniors are taking, the effect on brain function can be severe. There is also a phenomenon called opioid-induced hyperalgesia, where long-term opioid use actually increases pain sensitivity. Seniors on long-term opioids can find themselves in a cycle where they need more of the drug for less relief, while their mental clarity deteriorates. If you are managing chronic pain with opioids, I strongly encourage a conversation with a pain specialist about multimodal pain management, approaches that use lower doses of opioids combined with other strategies, or non-opioid alternatives where possible. So there you have it, 9 categories of medication that every senior and every family member of a senior should be aware of. Let me do a quick recap. 1. Anticholinergic drugs, including bladder medications and some antihistamines. 2. Benzodiazepines for anxiety and sleep. 3. Proton pump inhibitors for acid reflux. 4. Z drugs like Ambien. 5. Statins, particularly fat-soluble ones. 6. First-generation antihistamines like Benadryl. 7. Certain blood pressure medications, especially clonidine. 8. Tricyclic antidepressants like amitriptyline. 9. Opioid pain medications. Now, I want to close with this message because it's the most important thing I will say in this entire video. Do not panic. Do not stop any medication on your own. What I am asking you to do is become an active participant in your own healthcare. Print out this list. Bring it to your next doctor's appointment. Ask your doctor, are any of my medications on this list? And if so, do I still need them? Or is there a safer option for my brain? A good doctor will welcome that conversation. And if yours doesn't, if they dismiss your concerns without explanation, that is also valuable information. The medical community has a term for what happens when seniors take too many medications with overlapping side effects: polypharmacy. It is one of the most under-recognized causes of cognitive decline in older adults, and it is potentially reversible. I have seen patients come into my clinic looking like they were in the early stages of Alzheimer's, and after carefully reviewing and adjusting their medications, they have improved dramatically. Not in every case, but in enough cases that it gives me hope every single day. Your brain is worth fighting for. Your memories are worth protecting. And you deserve a doctor who treats the whole you, not just a list of symptoms and a prescription pad. I'm Dr. Naomi Chapelton. Thank you for watching. Please share this video with every senior you know, because this information truly could make all the difference. Take care of yourself, and I'll see you in the next one.